Hello, my name is John Ware. I'm a physical therapist at Guidry PT in Lacombe, and I'm going to demonstrate for y'all a kind of a go-to exercise that we use that I think a lot of people who've ever been in physical therapy for any kind of back problem have probably done, but I'm going to demonstrate it maybe in a way that's a little different and hopefully makes a little more sense. I'm going to demonstrate two different ways of doing the exercise. One maybe for a situation where your pain is more acute, and then another progression of the exercise after the pain maybe has subsided somewhat. Okay, so the first one, I'll have the patient lie down on their back on a firm surface. Okay. Hands resting on the abdomen, and I'll just start out telling the patient to start taking some slow, deep breaths. Feeling the belly rise on the in-breath and then fall on the out-breath. I caution people against breathing heavy. I just want them to take easy but deep breaths. Tummy rising on the in-breath and falling on the out-breath. Once the patient gets a sense of what I'm looking for there with the movement of the diaphragm, then I'll ask the patient to, as they inhale, poke the belly button up towards the ceiling as you arch your low back, and as you exhale, contract the tummy muscles gently and flatten the low back down to the table. Arching and flattening. Arching and floating back down. So the movement's being driven from down below, from the pelvis. The alternative, once things have calmed down a bit, is to transition into all fours, again on a nice firm surface. Start out just taking a few deep breaths down into the belly, feeling the belly expand on the in-breath, and then fall back down on the out-breath. In-breath, belly expands, and then the belly returns to the resting position on the out-breath. And then I'll have the patient perform the same movement as I just demonstrated on the back. In-breath, out-breath. In-breath, gently tightening the tummy, out-breath. Notice that the movement is all happening from here, rather than between the shoulder blades. That's that old cat-camel exercise that people are familiar with. Nothing wrong with that movement, but we're focusing here on isolating motion down in the lower back, the area that's the problem area. In-breath, out-breath. So that's the variation on the notorious pelvic tilt that we incorporate here at Guidry Physical Therapy Services. Just a little bit of a wrinkle, using breathing to help maybe drive your system into a more relaxed, calm state while you're moving, maybe incorporating some yoga principles that some of you might be familiar with. So we look forward to seeing you.